Today we discuss how trauma leads to losing a part of who we are. Trauma profoundly impacts our sense of self, often leaving us feeling adrift. It can disconnect us from our bodies, our emotions, and even our deepest sense of purpose. This profound disruption to self-awareness is a central challenge for many survivors. Today, we will explore how trauma fundamentally alters our internal compass and, crucially, how we can begin to find our way back to ourselves. Understanding these mechanisms is the first step toward healing and reconnection. Consider the experience of a young woman who compulsively picks at her skin. This behavior, while seemingly self-destructive, often provides a fleeting sense of relief from an overwhelming numbness. It is not an attempt to end her life, but rather a desperate effort to simply feel something. This profound disconnection from one's own body is a common experience for trauma survivors. They may find themselves trapped in cycles of self-soothing behaviors that, despite causing harm, offer a temporary escape from internal distress. Individuals often understand the negative consequences of these actions but feel powerless to control the impulse. This extreme disconnection from the body is a hallmark of trauma's impact. Even knowing the historical source of these impulses, such as early neglectful parenting, often does not diminish their power in the present moment. The urge persists, driven by a deep-seated need to regulate an internal state. Our ability to regulate emotions is largely learned through early life experiences. When a child's needs are consistently met, when they are fed, when hungry, or comforted when scared, they learn that their internal states are manageable and that others can help them cope. This consistent soothing builds a foundation for healthy emotional regulation. However, a lack of early soothing experiences often forces individuals to develop their own self-coping strategies. These strategies, born out of necessity, may become maladaptive over time. Unhealthy coping behaviors can manifest in various forms, including substance abuse, eating disorders, or self-harm. These behaviors are not moral failings, but rather deeply ingrained responses to overwhelming internal states. They represent an attempt to manage pain when healthier mechanisms were never adequately developed or supported. Recognizing this origin is crucial for fostering self-compassion and seeking effective help. Our brain has a fascinating default state known as the default mode network, or DMN. This network becomes active when we are not focused on an external task, allowing our minds to wander, reflect, and engage in self-referential thought. The DMN is crucial for our sense of self-awareness and for monitoring our internal world. It is composed of several midline structures extending from the front to the back of the brain. Each component plays a vital role in constructing our internal experience. Understanding these parts helps us grasp how trauma can disrupt this intricate system. Key components of the DMN include the orbital prefrontal cortex, involved in decision-making and reward. The medial prefrontal cortex acts like a watchtower, helping us understand our own thoughts and feelings and giving us a sense of purpose. The anterior cingulate cortex coordinates emotions and thinking, integrating our internal and external experiences. The posterior cingulate cortex functions as an internal GPS, providing a sense of spatial location and our place in the world. Finally, the insula registers sensations from the body, connecting us to our physical self. Together, these areas create a coherent sense of who we are and how we feel. In individuals with post-traumatic stress disorder, the default mode network is often significantly disrupted. Areas of the brain responsible for self-awareness and internal monitoring become less active, leading to profound changes in how one experiences themselves. This reduced activity can manifest as feelings of detachment and a loss of direction. The medial prefrontal cortex, which is strongly associated with our sense of purpose and self-reflection, may be significantly shut down. This explains why many trauma survivors report feeling lost, lacking motivation, or struggling to connect with their own emotions. It's as if the brain's internal watchtower has gone dark. Research has shown almost no activation in these self-sensing areas of the brain in some PTSD patients. This is not a conscious choice, but a deeply ingrained coping mechanism. Trauma survivors learn to shut down brain areas that transmit visceral feelings and intense emotions as a way to survive overwhelming experiences. The disappearance of MPFC activation directly explains the profound loss of purpose and direction that many survivors describe. When the brain's self-monitoring system is compromised, it becomes incredibly difficult to navigate one's internal landscape or find meaning in daily life. This neurological shutdown is a protective response, but it comes at a significant cost to self-awareness. Our bodies are constantly sending signals to our brains. These signals communicate everything from hunger and tiredness to pain and pleasure. This intricate, self-sensing system is the fundamental basis of our self-awareness. It provides crucial feedback, helping us understand our needs and respond appropriately to our environment. This constant communication from our viscera, muscles, and extremities profoundly influences our thoughts and actions. It operates largely without our conscious input or awareness, forming the background hum of our existence. It tells us when to eat, when to rest, and when to seek comfort. In the context of trauma, this vital system can become overwhelmed. When the body is subjected to constant or perceived threat, its signals become chaotic or are deliberately suppressed. This can lead to a profound disconnect, where the body's messages are either ignored, misinterpreted, or simply not registered by the conscious mind. The self-sensing system, designed to keep us safe and connected to ourselves, can become a source of distress or numbness. Reconnecting with these internal signals is a critical part of healing. The first and most crucial step in healing is to understand that these behaviors and feelings are not personal failings. They are understandable, albeit often painful, responses to trauma. This shift in perspective from self-blame to self-compassion is incredibly empowering. Your struggles are not weaknesses. They are evidence of your brain and body's attempts to cope with overwhelming experiences. Trauma-informed therapy offers a structured and supportive path toward healing. Therapists trained in trauma understand these complex neurological and psychological impacts. They can help you navigate the process of reconnection without judgment. Therapy aids in gently re-establishing a connection with your body, allowing you to safely process emotions that may have been suppressed for years. It helps in rebuilding a coherent sense of self, integrating fragmented experiences, and restoring your internal compass. This journey involves learning new coping skills, understanding your triggers, and gradually reactivating those parts of your brain that help you feel whole again. Healing is a process, not a destination. It requires patience, courage, and consistent effort. But with understanding, support, and the right tools, it is absolutely possible to reclaim your sense of self and live a life of purpose and connection.